Hello and thank you for joining us. Today we will be covering enhancing ulcerative colitis care, combining a fast mimicking diet with induction therapy.
Ulcerative colitis is a form of inflammatory bowel disease that affects the innermost lining of the large intestine, mainly the colon and the rectum. The inflammation leads to the formation of ulcers and sores. The gold standard for diagnosis is an endoscopy with a biopsy, although stool studies can be used to support the diagnosis. We still don't know the exact cause, but we do know that genetics play a significant role, with about 14% being tied to hereditary factors. It's also more common in individuals of Jewish descent. In ulcerative colitis, the epithelial barrier of the colon becomes damaged. When that barrier breaks down, the mucus layer and tight junctions that normally protect the tissue weaken, allowing bacteria and their products to penetrate deeper into the mucosa. There's also a shift in the gut microbiome, with protective bacterial species decreasing while more inflammatory ones increase. The immune system responds abnormally. Macrophages, neutrophils, and T helper cells release inflammatory cytokines like TNF-alpha, interleukin 6, and interleukin 23. Over time, this inflammation causes epithelial cell death, crypt abscesses, ulceration, and structural distortion of the colon. Current therapies for ulcerative colitis, especially drug therapies, often come with significant side effects, loss of effectiveness, or the need for long-term use. Surgery is an option for some patients, but it carries serious risks and long-term lifestyle changes. This is where dietary strategies, especially the fasting mimicking diet, come in. The idea is that a diet-induced fasting state may help reduce inflammation, support mucosal healing, and potentially enhance the effectiveness of advanced therapies. So our focus is on whether the diet can serve as a safe, non-pharmacological adjunct. The fasting mimicking diet is a short-term, plant-based, low-calorie diet that mimics the metabolic effects of fasting, but still provides essential nutrients. In this clinical trial, we're looking at how the FMD influences various inflammatory pathways in the colon. Our hypothesis is that patients who receive induction therapy plus the fasting mimicking diet will experience higher remission rates and better biomarker improvements than patients receiving induction therapy alone.
In this trial, we had 32 active participants, all over 18. 18 were in the control group receiving advanced therapies alone, and 14 were in the intervention group receiving both advanced therapies and the fast mimicking diet. This was a phase 3 randomized control trial. Patients received one of 3 advanced therapies, tofacitinib, ustekinumab, or infliximab. The intervention group also completed 2 5-day cycles of the fast mimicking diet during weeks 2 and 7, while the control group followed their normal diet. The intervention group showed better clinical remission and clinical response compared to therapy alone, 57% versus 38%. Biomarkers also improved more significantly. Fecal calprotectin levels dropped from 3,710 to 1,375 in the intervention group, while the control group actually increased. C-reactive protein levels fell sharply as well. Overall, the combined approach reached statistical significance with a p-value of 0.05. Patients who completed the fast mimicking diet reported fewer flare symptoms, less diarrhea, abdominal pain, and urgency. Quality of life scores improved too. 11 patients didn't complete the study, but importantly, none of the adverse events were linked to the diet itself, suggesting the fast mimicking diet is safe and well tolerated. Our main limitations were a narrow patient group, limited ethnic diversity, and a short follow-up period. Adherence to the diet was also another challenge. Future trials should include broader populations, extend follow-up, and use objective adherence measures like ketone monitoring to verify fast-like metabolic changes.
Ulcerative colitis is a very active area of research with 262 ongoing clinical trials. Most, about 234, are interventional, testing new treatments. Over 75% are phase 2 or 3, showing a mature pipeline focused on evaluating safety and efficacy. However, very few trials have explored dietary interventions. In clinical practice, the fasting mimicking diet could be used as a supportive therapy to enhance response to advanced treatments for moderate to severe UC. The suggested protocol is 2 5-day FMD cycles during weeks 2 and 7 after starting the therapy. It's intended for adults, excluding anyone under 18, pregnant, underweight, or prone to fainting while fasting. We are deeply grateful to Dr. Cavalier for guiding us through each stage of this project. Her support and thoughtful feedback inspired us to think critically and approach research with compassion and curiosity. Also, thank you for taking the time to learn about our work. We hope that it encourages continued exploration of how clinical research can create meaningful change.